Hello. Hello, hello, hello. Interpretation, hello. Honorable Zingas.
Hello, Chief. This is control room.
Jacob.
It's Peter,
yes.
Chief. It's Peter.
Oh,
Chief.
it's Peter, okay.
Yes, we are still just trying to sort out the interpretation. I'll let you know when we are ready to.
Can you interpret? Zingas is the chairperson of the committee. Speaking in French is Zingas. The interpreter, can you speak to Honorable Zingas and tell him that you are doing some repairs?
Okay, no problem. I'll do that.
Okay, fine. I can say everyone's ready. I can proceed there. Can you ask Honorable Zingas whether he's ready? Then I can proceed. Thank you very much. Thank you very much. First of all, you have been told this is Chief Sharumbira, Vice President at Pan-African Parliament. But before we proceed, interpretation. Are you okay? Can I start again? Can I proceed? Can I proceed now? Can I proceed? Right. I started off by saying, first of all, welcome, honorable members, welcome the chair of the Health Committee and the Committee on Gender at the Pan-African Parliament, and all honorable members, our experts, our interpreters, and the staff of PACT. But as a first step, can we have a moment of silence in memory and the honor of all those members of parliament who have passed on in the last few months, and even our own staff members who have had their bereavement, and the victims of coronavirus across the globe. So that's a minute of silence. Thank you. I can proceed. I first of all address the chairperson of the Committee on Health, Labor, and Social Affairs, and also the committee chair on gender, family, youth, and people with disabilities. I say welcome to this meeting, including all the committee members, honorable members for the two committees. Welcome also our experts, staff of PACT. Owing to the coronavirus epidemic, we have not been able to meet in our formal setting in Midrand as we had scheduled for May, end of April to May. We had scheduled that we would be in session. We have not been able to meet because of the coronavirus epidemic, which you're all aware of. However, I'm very, very gratified, the honorable members, and other persons present in this meeting. I'm very gratified that after having lost May, in June we are meeting, or we have convened this afternoon, but in a very new context of virtual meeting or online meeting. The reasons for this are obvious to all of us. Because of the COVID-19, we have not been able to meet in one room and look at each other faces and enjoy the whole love among ourselves and interact. But we still want to thank technology, which has now enabled us to be able to share, meet, share information and ideas, and move on with our business. I know you want to know that PAP is going to meet. All I can say is that once the situation allows, once airlines are now back in the air and landing everywhere, when we're able as a continent to gather in one place, PAP will start meeting again, have its committee meetings and plenary sessions. But for now, let's use what is available. And say we are happy that across the continent, we are participating in this meeting, maybe some beyond the continent. I will not give statistics on the coronavirus or COVID-19 pandemic. I'll leave that to the presentations which are going to follow. So without wasting your time, what I should emphasize through the chairs of health and gender as a parliament and members of these committees is that with this, the crisis, the pandemic facing us, we as Pan-African Parliament, we have to be seen not only to join the fight against the epidemic, but to take a lead because we are the voices of the people. We can't be quiet and hide in our homes and lock ourselves and say we are now locked down somewhere. We are keeping our distance, yes, but we also have to pass the tests. People are desperate. The world is desperate. And a lot of initiatives are being undertaken. We purpose to rise up and be counted in the face of such a crisis of this magnitude. And we have to keep reminded that we are the representatives of the people. Our people are in a crisis. What is PAP saying? What is PAP saying with this crisis? Let us play our usual role as a parliament. Let us play our usual role as a parliament, which is to get the views of the people, which should feed into all the initiatives in our own national governments across the continent. Whatever is being done, are we sure that our people are being carried on to understand the initiatives? Let us all, as usual, exercise our oversight function, which is to see the expenditures. A lot of big monies are being spent on COVID. Can we say things are being done in transparently and that people understand what is happening? So the roles of representation, the roles of oversight, including meeting to pass budgets to allow for those expenditures and follow them up, and also including the roles of lawmaking and the policy change. So COVID has created new imperatives such as reallocating resources. It's our role to make sure that those resources are reallocated properly. But without taking too much of your time, I'm saying health committees, national and continental, and the Honorable Zingas as chair of health and the gender and other committees, an enormous task has been placed on your responsibilities as committees to try and be part of the solutions of this pandemic. And we are saying, Pan-African Parliament and the Bureau, we will facilitate, we will support you to undertake your activities, meetings, in order that as Pan-African Parliament, linked to the national parliament, that we perform our roles as a parliament and we try to come up with mechanisms that can mitigate, alleviate, even end this coronavirus. I want to wish you a very good afternoon, a good presentation, healthy discussion, and exchange of ideas this afternoon. And I want to see you meeting more and more so that we are active from wherever we're operating from. I thank you very much, Chair, for the chairpersons. I will end here for now. I will listen to the next presentations. I may not stay at the end, but I'll listen from the first two presentations. I'll be present. Thank you very much.
Dr. Raji Tajuddin from the African Union Commission, Dr. Chuma, Regional Director of UNAIDS for East Africa and Southern Africa, Dr. Christian Muller from UNAIDS. Ladies and gentlemen, senior officials of the Pan-African Parliament, as I said before, in my previous message, during the joint meeting of our two committees on the 3rd of March 2020 in Midrand, when UNAIDS made their presentation, I said that the coronavirus, COVID-19, has erupted all of a sudden in the entire world. That time, that is in March, there were only 4 countries from Africa that were affected. Today, it is the entire continent that is hit by these pandemics. Despite the drastic measures states to thwart these pandemics, COVID-19, the situation is tending worldwide and at the African level has been increasing very rapidly. The statistics globally are alarming. Dr. Raji Tajuddin, in his presentation, will certainly enlighten us on the African statistics in this matter. We talk today worldwide about 7 million contaminated cases. And this virus claimed thousands of lives. It is therefore, we can therefore say that mankind is experiencing the most serious sanitary or health crisis ever. And of course, this reduces the disparities among the countries. In face of COVID-19, there is no rich country or poor country, no great or powerful country, no small or vulnerable country. International solidarity can, on its own, curb the advance of these pandemics. The fourth Vice President of the Pan-African Parliament, in his introductory remarks, was right to say and to draw our attention as MPs, since in a month, some countries will start within their national respective parliaments to consider the budget laws before even starting the financial code of 2021. I hope that the budget for 2021, in the budget of 2021, particular focus and considerable efforts be directed to the health budgets of our respective countries. In our countries, we are used not to devoting much of money, of funds in the field of health. Today, each and every day, we hear the word health in all mouths. When we listen to the media, when you look at the TV, we always talk about health, health, health. We believe, therefore, that our leaders, and we hope that our leaders will make sure that the budget allocated to health departments in our countries be a priority compared to other sectors. This is why we need to start working resolutely to achieve the expected results at the service of our populations. I would like to wholeheartedly thank, on behalf of the Pan-African Parliament, Madagascar. I'd like to thank Madagascar that produced the organic sub-product. Excuse me. And for making it available to our countries. We in our countries in Africa should count, first of all, on our own efforts before expecting any help or assistance from elsewhere. We encourage all the African scientists to work together, hand in hand, to make sure that the product that will be found out to contain and to thwart these pandemics be an African product. On this note, and with your permission, I'd like to give the floor now to Dr. Raji Tajuddin from the African Union Commission to make his presentation. And then we'll have a second part that will also, of his presentation, that will also be made by Dr. Tajuddin, and then we give the floor to our partners from UNAIDS, who will also make their presentation. And after that, we will open the discussion. And during this discussion, I will also hand over to my colleague, the chairperson of the Committee on Gender, who also will take the floor and make the concluding remarks of our session. Let me thank you all the colleagues, all the officials, the interpreters, Dr. Tajuddin from the African Union, our partners from UNAIDS, the Bureau of the Pan-African Parliament, and the clerk office, all those who organized this virtual meeting. I thank you all. I don't know whether Dr. Rajiz is ready to start.
Yes, I'm ready to start. Good afternoon.
Okay.
Can you hear me? Hello?
Yes, we can hear you.
Okay, perfect. So I would like to share my screen. So can I be given permission to share my screen?
Yes.
Hello?
Yes, you can.
Okay, I can share the screen now.
Yes, share it.
Okay, perfect. So let me pull out. Okay. Can you see my screen?
Yes, we can. You can make it click on the yes.
Yeah, it's full screen now. All
Yes.
right. So good afternoon, Your Excellencies, distinguished colleagues, ladies and gentlemen. On behalf of the Director of Africa CDC, John Gregerson, I say welcome to this important webinar that is looking at COVID-19, one in the aspect of humanitarian response, and two, also looking at it from the perspective of our health system as African. So my name is Raji Tajuddin. I'm the head of our Public Health Institute and Research for Africa CDC. As of today, our estimate globally of COVID-19 is over 7.6 million confirmed cases. And we have more than 420,000 deaths, with 6 out of every 100 cases dying. That's 6%, which is quite big as far as the population is concerned. And of course, this is pandemic. It's affecting more than 200 countries and territories worldwide. Let's come back to Africa. As of today, Africa has over 250,000 cases, and this is around 2% of the global total. Before now, we used to be less than 1%. Now we are talking of 2%. And in terms of death, we have over 6,700 deaths. This is around 1% of the global total. And close to 50% of our cases have actually recovered from their illnesses. And if you look at our graph, our trajectory, over here, you discover that we are still going up, meaning that the situation is still evolving in Africa. We don't know where we are going, but having said that, we have some couple of modeling studies here and there that is predicting that we may have close to 190,000 deaths in Africa before the end of this year. And we have more than 10 million cases on the continent. This is projection. This is what we call modeling. But again, it all depends on what are the efforts we deploy as a continent to prevent this prediction from happening. Now, if I'm allowed to unpack the continental average further, you will see that we have more cases from Southern Africa. We have over 40,000 COVID-19 cases. If I'm allowed to, and we also have close to 30,000 cases from North Africa. Now, so it's only Central Africa that is still below 10,000 cases. And it's important to know that 54 out of our 55 member states have been affected. The only country so far that is yet to report a case is Western Sahara. And otherwise, every other country has reported one case or the other. Again, this is a map showing the distribution of cases based on our countries. You will see that about 6 countries have more than 10,000 cases. So these include Nigeria, Ghana, Egypt, Algeria, and South Africa. But the good news is that 43 countries still have less than 5,000 cases. But as I mentioned earlier on, the situation is fastly evolving, so we need to step up our response and efforts. So what have we done as Africa? That's at the level of our respective countries. Countries have instituted closure of educational institutions. So a lot of countries have banned public gathering. In fact, all countries have banned public gatherings. About 20 countries have put limitations on hospital visits and visits to places of detention. We have about 41 countries who have imposed public use of face masks. So these are the different measures that have been put in place by our different countries. As I'm talking to you, close to 16 countries still have national lockdown. That means you cannot move anywhere. And you will agree with me that all these measures have serious implications on the social and economic aspect of the continent, especially on our working class, in the absence of mitigating measures in terms of social and economic package or stimulus to alleviate some of these negative impacts. Still on restrictions, about 43 member states still have full border closure. That means you cannot move, you can't travel there, and this also has huge implications in terms of logistics and supply chain management. And for us as frontline and responder, this also has a lot of implication in the sense that our ability to move things around and to also move people around to assist member states may one way or the other be slowed or even altogether be affected. So as Africa CDC, what are we doing, or as Africa Union? So we have put in place a very comprehensive coordination mechanism right from the level of our head of state. As you can see there, the head of states are championing our overall COVID-19 strategy under the leadership of President Cyril Ramaphosa of South Africa. We also have our ministers. We call them coordinating ministers or coordinating committee of ministers who are also providing oversight. And this includes ministers of finance, ministers of transport, ministers of health, and other relevant ministries. They have all played their role and they continue to play their role. Of course, we have the technical experts who are overseeing the continental strategy that has been approved by our ministers of health, because we all know that as individual country, there's little we can do as far as this COVID-19 is concerned. But when we come together, we're able to do a lot. So this explains why Africa CDC has put together a continent-wide strategy and a continent-wide task force to, address this COVID-19 on the continent. And this task force has focused on key areas, starting from surveillance to supply chain and stockpile to research, laboratory diagnosis, risk communication and community engagement, case management, of course, infection prevention and control. So these are areas that we have been able to focus on. It's also important to know that as part of our coordination mechanism, the regional economic communities are also part of this continent-wide strategy, so that we can be able to move and respond as one block in a very coordinated and transparent manner. So what is Africa's strategy as far as this COVID-19 is concerned? So our strategy is anchored on three main pillars. The first one is to prevent transmission of COVID-19. Two is to prevent death as much as possible. Even if you come down with COVID-19, we want to make sure that the clinical outcome is excellent. And the last but not the least there is to prevent social harm. So, and as part of our strategy, we have been able to roll out what we call partnership to accelerate COVID-19 testing on the continent. And this is under the leadership of the chairperson of African Union Commission, Musa Faki Mahamat. And this strategy or this initiative is aimed at one, scaling up testing, two, to establish African-wide food procurement. You all agree with me that one of the major challenges as far as responding to this COVID-19 outbreak is concerned is global shortage of medical supplies. So I would believe that as a continent, the only way to approach this is to come together, put in place a pool procurement platform that will allow our member states affordable and equitable access to these medical supplies. And we have also been able to put in place a kind of storage and distribution hubs to make sure our logistic and the supply chain management is able to move seamlessly across the different member states. We know that quite a lot of our member states have what we call critical shortage in health workforce. So as part of this initiative, we'll be supporting member states with 1 million health workers to support the testing, the tracing, and treatment. And of course, we also be relying on our technology to make sure that we're able to move this agenda forward as fast as possible. The testing, the tracing, and treatment. Of course, we also be relying on our technology to make sure that we're able to move this agenda forward as fast as possible. I'm trying to move the slide. Okay, so the big question will be, why do we have to put in place PACT, that's Partnership to Accelerate COVID-19 Testing on the continent? We believe that with testing, we're able to identify and isolate every suspect case. We're able to follow or do what we call contact tracing for every contact of a case. we are able to uncover areas of concentration of cases, and we are able to have a better insight and a better understanding of what this COVID-19 is all about as far as our continent is concerned. So if allowed to unpack this, our initiative further. So this initiative is focusing on testing, to make sure that each and every suspect case is able to have access to testing. Two, to make sure that we trace each and every contact of a positive case. And three, to treat and provide the needed support for every symptomatic case. So in terms of this initiative, what have we been able to achieve? At the outset, cumulatively on the continent, all we had was less than 500,000 tests cumulatively. Today, we are around 3.6 million tests, courtesy of this our initiative and the support from partners. Less than 500,000. What else is Africa CDC doing? Again, we know that we cannot respond to this outbreak without the support of our community. So community engagement has been very, very key to what we are doing. So in this regard, we have a technical working group that is working on risk communication and community engagement. And with this technical working group, we have been able to track most of the rumors and address them as much as possible. You agree with me that one of the major problems with this outbreak is misinformation and disinformation. So this is what our rumor tracking team is doing. You track that rumor and you provide the expertise information. Of course, we also have a partnership with Facebook to address some of these issues. And last but not the least, we continue to support our journalists on public reporting. We also have a partnership with Facebook. So Africa CDC has also been able to support our member states with the necessary guidance document so that they'll be able to respond based on available evidence. One of these documents is one that is looking at how do we go about easing lockdown. You agree with me that at the outset, a lot of countries locked down, and now quite a lot of them are opening up. So we felt that as a continental agency, there is need to guide that process. And guiding that process means that we want to ensure that the opening up follows public health and social measures, so that we'll be able to slow down this COVID-19 transmission. And we introduce some sort of stepwise approach when it comes to opening up. You don't just open up just like that. You need to be very strategic, and it has to be stepwise, and you monitor what you are doing. You can open up, the cases are coming up in such an uncontrollable manner, not to stop us from closing some institutions back, so that we make sure we get it right before we open up. And of course, as much as possible, we want to protect the vulnerable groups. And what are these vulnerable groups? These are the elderly, people above the age of 60 or 65, depending on the local context. And of course, people with underlying medical conditions. So all these people need to be protected as we begin to open up. And of course, social behavioral change is also key when we open up. We need to continue to use our mask. We need to continue to ensure that physical distancing is obeyed. We avoid public gathering. We go out only when it's absolutely necessary. All these are key. One thing we need to know is that it's not one thing that will control this pandemic. It's going to be a combination of a lot of factors, a lot of interventions that will control this pandemic. We know that this pandemic has had huge mental health and psychosocial impact on our populace. And in this regard, Africa CDC has produced a guidance document to support our member states in terms of mental health and psychosocial issues. So this is a document that is addressing the needs of the community. It's addressing the need of healthcare workers. It's addressing the need of even we as a caregiver. So in summary, this is a document that is addressing the needs of the infected and the affected. Again, the document also spell out how to address some key psychosocial issues like stress, anxiety, and so on and so forth. Again, we know that one of the things that will bring about or that is going to be a game changer as far as this COVID-19 is concerned is the issue of vaccine. So next week on the 24th and 25th of June, the chairperson of the African Union Commission, His Excellency Musa Faki Mahamat, is going to be convening Africa's leadership role in COVID-19 development and access conference, and the essence of this meeting is to make sure that when this vaccine does become available, affordability and equitable access is guaranteed for our member states. We want to avoid a situation whereby we have to rely on trickle-down effect. We want to be among the first set of people that will benefit from this vaccine. And we want to use this opportunity to also begin to look at how we will build our capacity as far as research and development of vaccine is concerned. And of course, we want to begin to engage our community before even this vaccine come on board, so that when it does come on, the issue of uptake at the level of the community will not be an issue. So this is why we are putting up this meeting. And Your Excellency, distinguished colleagues, ladies and gentlemen, to conclude, I know that we are responding to COVID-19. It's driving a lot of our resources. It's having a lot of socio-economic impact. But what we should not avoid is we shouldn't lose sight of other essential health services. Essential health services are things like malaria, things like diarrhea, things like TB, things like malaria. So in this regard, Africa CDC has issued a guidance document that will support our member states in such a way that they will continue to run these essential health services. So they will have in place a protocol that will govern this. They will have in place a monitoring mechanism that will make sure that people still continue to have access to these essential health services and address whatever gap. And in terms of our messaging, we will continue to talk about the need for continuity of essential health services. And the main reason behind this is that if we do not continue to talk about this, at the end of the day, more people may end up dying from these other services, these health issues, other than much more than the COVID-19. So distinguished colleagues, excellencies, ladies and gentlemen, I've come to the end of my first presentation. Thank you for your attention. Over. Over. Do I move to the next slide? The next presentation? Mr. Moderator, okay, let me proceed to the next presentation so that I can take the questions once and for all. So once again, thank you for the invitation and for the opportunity to present what Africa CDC is doing to the distinguished colleagues and excellencies on this webinar. So my second presentation will be focusing on overcoming inadequate healthcare services in response to COVID-19 in Africa. So what have we done as Africa CDC to support our member states? So right from outset, Africa CDC recognized the fact that our health systems in Africa is relatively weak. That's one. Two, we know that more than 50% of our member states do not have access to modern health facilities. Most of our member states do not have what we call ventilators in case we have people with severe COVID-19 or critical COVID-19 cases presenting. We know that a lot of our member states budget less than 10% of their GDP on healthcare, which is against what Abuja Declaration, stipulated. Can you hear me? Yes.
Interpretation is not coming through in French, so it seems.
Okay.
interpretation in French, please.
Yeah. Can I proceed? Okay, je vous remercie. So right from outset, we knew that our health system on the continent is weak. And the reasons are that less than 50% of our member states actually have access to modern health facilities. And I give ventilator as an example. When we did our first mapping, 10 of our member states do not have a single ventilator, but thanks to our intervention, virtually all the member states now have ventilators in place. Two, in terms of financing for health, most of our member states spend less than 10% of their GDP on health, as against 15%, which was what has been prescribed, by the African Union. In terms of health workers, a lot of our member states have on the average 2 health workers per 1,000 population, which is far less than the standard of 25 health workers per 1,000 population. And of course, we are a continent that continues to have recurrent epidemic outbreak. As we're having this COVID-19 outbreak, there's an outbreak of Ebola in DRC going on. So we continue to be plagued by different epidemic outbreak. And right from outset, we also identified that some countries will be affected much more significantly than others. We have much more burden than others. Countries like Nigeria, like South Africa, like Egypt, like Algeria and Morocco, based on our modeling at the outset. And that prediction has come to pass. So as I'm talking to you today, these 5 countries are still leading in terms of numbers on the continent. So what was the approach Africa CDC took? Firstly, after the epidemic was declared, Africa CDC updated all the regional collaborating centers about the COVID-19 outbreak. Secondly, we activated our incident management structure, which will allow us to respond as a continent in a coordinated manner. And third, we were able to brief member states on what is it that we should be doing in preparation should this COVID-19 arrive on the continent. And on 14th of February, the first case was recorded in Egypt. And a week after this first case was reported, Africa CDC, through the chairperson of African Union Commission, convened high-level emergency ministerial meeting. And the outcome of this meeting emphasized the need for coordination, communication, collaboration, and cooperation. This ministerial meeting also endorsed the Continental Armed Strategy and the Continental Armed Task Force, because we know that the only way we can respond better and in a very efficient manner is to respond as a continent. So in terms of our key achievements, we were knowing fully well that most of our health system or most of our member states are very weak health system. First, in the area of surveillance, which is to monitor the disease, we were able to train 23 member states, especially those at very, very high risk, and we focus our attention on point of entry. Two, we were able to set up a platform to train our clinicians, our physicians, our doctors, our nurses, so that at least before, the COVID-19 begin to have a serious impact on the continent, we have people that have the technical know-how to treat those cases. And we also targeted about 15 countries who, based on our modeling, felt they were at very high risk compared to others. And we were able to do on the ground physical, that's face-to-face training for these 15 countries. In terms of infection prevention and control, we're able to target 37 countries, train them on site, physically. And as I'm talking to you now, we have an online platform that continues to train our member states on infection prevention and control. In terms of supply chain and stockpiling, we were able to work with the Jack Ma and Alibaba Foundation to support member states with test kits, support member states with personal protective equipment, and we're able to also support member states with some set of ventilators. Then, of course, in terms of lab diagnosis, let me say here that at the outset of this outbreak, there were only 2 countries that could diagnose COVID-19 on the continent, and these were South Africa and Senegal. That's at the beginning of February. By the end of February, Africa CDC built the capacity of 48 member states, which is virtually all the member states, in terms of ability to diagnose COVID-19. You will agree with me that for you to respond, you should have the capacity to diagnose, to identify the COVID-19. Then, of course, we continue to work with our community because community engagement is key in terms of responding to outbreak. Again, for point of emphasis, this is our strategy, and we continue to be guided by this particular strategy. And in terms of supporting our health system, we continue to work with our lab to build what we call genomic sequencing capacity. This is to be able to identify the causative organism to the minute detail so that we know where is this organism coming from, which particular type is this, and how best to approach it. If you all recall, the first set of cases in Africa, we were able to identify that these cases were coming from Europe and not necessarily from China, because of this genomic sequencing capacity. And of course, we've been able to also work with our private sector to support member states with those machines that will be able to allow them, to diagnose cases of COVID-19. And in terms of guidance document, we've been working with WHO closely to support member states with the necessary guidance document that is based on evidence. And we continue to hold online training to support member states in all the key areas of our response. And the other thing we've been able to do is to also map what exactly is the capacity on the continent, because that's the only way you'll be able to know what are the gaps and what you need to do to address this gap. So we're able to do that, and we continue to update this particular data. And with this, we've been able to support our member states with some sort of medical supplies, from personal protective equipment to ventilators and to test kits. So allow me again to unpack further what we are doing to build member state capacity in terms of scaling up testing, scaling up tracing, and scaling up treatment. Because as we begin to ease lockdown, or as we begin to unlock our countries, we need to replace that with a strategy that will not allow the cases to start going up, needlessly resulting in unnecessary deaths. So in this regard, we set up what we call a strategy to make sure that we're able to test, each and every suspected case. And our target here is that by October 2020, we should have been able to test 10 million of our cases on the continent. So that if we break this down in terms of a test per million population, we'll be talking of something between 8 to 10,000, which is, what you need to do to make sure that you have done adequate testing and you know, or you are close to knowing the exact burden of COVID-19 in your country. We'll also be deploying community health workers, and specifically 100,000 of these community health workers will be trained, will be given the necessary skills to be able to support our member state by Africa CDC. The remaining 900,000 will be working with partners like Red Cross, like UNICEF, like AMREF, UN8, to support us in terms of deployment of these other community health workers and training. And again, for point of emphasis, the procurement platform will allow us to get the necessary medical supply to meet this our target of 10 million tests, 1 million community health workers, support our countries with intensive care unit capacity, ventilators, oxygen, because with poor procurement, you are able to negotiate for the best price that is available out there. You are also be able to have equitable and affordable access to most of these medical supply, and you are also able to get good quality materials coming in. So let me unpack the testing aspect a bit further. When we started as a continent, before we roll out this PACT initiative, we had less than 200,000 tests on the continent. Today, we are proud as Africa CDC and with support of our partners, WHO Afro, WHO EMRO, IOM, and so on and so forth, and support of member states as well. Now we are talking of 3.6 million tests on the continent. And we said that our target is by August, we should be talking about 10 million tests. Then we can comfortably say that, yes, we know the exact burden of the COVID-19 on our country. Of course, you all agree with me that we are not all on the same level as far as this testing is concerned. As you can see on the screen, we have about 10 countries leading the pack. But for those other countries too, we are working closely with them to understand what is it that is keeping them down as far as testing is concerned, and we're supporting them as appropriate on how to scale up their testing. So we have also been able to provide interim guidance, on the use of some sort of what we call a rapid diagnostic test on the continent, which again will allow us to understand this COVID-19 better on the continent. It's also shortening the turnaround time, to allow us to screen people. In fact, this is also of importance as we begin to open up our airspaces, because with rapid diagnostic tests, even you can deploy it at the airport, so that you know who is having COVID-19 and who is not, and take appropriate measure. We continue to train our member states on the lab diagnosis. We also continue to provide technical support. As I'm talking to you, we have deployed some couple of community health workers, and we have also deployed epidemiologists, infection prevention and control experts, data managers, communication experts to support some member states, and this was purely based on request and need. So we've done that, and we have also been able to work with partners to also deploy them accordingly. In terms of supporting tests, we have also, worked with some partners to provide specific equipment like Gene Expert machine and Gene Expert cartridges to support member states that do not have a PCR machine, or those that have PCR machine but not enough, to support them with something that is quite mobile. So for the treat component, again, we know that the capacity out there is very weak. So we have a technical working group that is in place, and this technical working group is providing the needed support for managing our COVID-19 cases. We know that more than 80% of our cases will have mild symptoms, and nothing stops us from managing this category of cases at home. And this is the only way we can avoid our health facilities becoming overwhelmed. So in this regard, we are working with partners, we are working with our diaspora community to make sure that we build the capacity of our community health workers so that they can identify, they can recognize and follow or take care of these mild cases without compromising or without contaminating the home environment. So again, we know that early identification is key. So we are working with partners to ensure that we're able to identify our cases as early as possible before they even begin to contaminate other environment, and institute appropriate management. And for moderate to severe cases, we know that these are the ones that we need intensive care unit. These are the ones that will need hospital admissions. These are the ones that will need oxygen. These are the ones that will need ventilators. So Africa CDC has been working from morning to night to ensure that we get the appropriate medical supplies through our platform. And in this regard, we've been making sure that we build local capacity, one, and as much as possible, we ensure transfer of technology, meaning that purposefully, we make sure that our platform favor local manufacturing of our medical supplies. So in terms of tracing, of course, we have also, we are supporting member states in terms of capacity building. We are providing necessary personnel, to support, to train, and then make sure that they are able to trace each and every contact of a positive case. We are also working with our community health workers in what we call some sort of task shifting, building their skills so that they're able to carry out some of these routine procedures, again, to free the time of our key experts so that those one can focus on the seriously ill cases. So this is what we've been doing in terms of key priorities: weekly online courses, continue to update our intensive care unit capacity, continue to look at who is doing what in terms of research and clinical trial on the continent and provide the necessary support. We are mapping and engaging our local manufacturers, so that, because this is the only opportunity to build our local capacity, and we've been working with our science and technology department and colleagues to ensure that we're able to build the capacity of our local manufacturers, and we continue to support our member state with the guidance document. So what more do we need? So to summarize, we want the PAP to continue to work with us as partners, as far as responding to this COVID-19 outbreak is concerned. No single individual, no single country can do it alone. So we need your support on this. Two, we know that medical supply will be a big issue. So we have put in place a pool procurement platform under the leadership of President President Cyril Ramaphosa of South Africa, and our private sector through Strive Masiyiwa and Group. So this is a very robust pool procurement platform. So as much as possible, let's encourage our suppliers, our sourcing and procurement company to go to this platform and support the member states that need this medical supply. We are also working with our telecommunication companies to make sure that whatever we are doing, in order to take it to scale, we will need some sort of technology. So we'll be counting on their support, and we'll be relying on PAP to also support us on this. We are also talk of 1 million health workers. Africa CDC is not going to do this alone. What we are doing is to catalyze the process, is to charge, the vision ahead, and then we rely on all relevant stakeholders to support us on this and then support the response to COVID-19 pandemic on the continent. We continue to talk on the need to continue our essential health services. So we are calling on partners. If you are on this webinar today, please continue to support the HIV, TB, and malaria programs. Continue to support whatever you are doing as far as non-communicable diseases are concerned. We want to avoid a situation where at the end of the day, we will lose more people through these essential health services and not necessarily through COVID-19. So let's continue to ensure that sexual and reproductive health rights, childhood immunization, youth-friendly services, non-communicable disease programs, all these continue to run as appropriate. Of course, vaccine, I've talked about that, and it's very, very important. We need the Pan-African Parliament to support us on this journey to ensure that when this vaccine does become available, affordability and equitable access is key, So also for other therapies. So we need your support on this. And of course, we know that this COVID-19 is going to have huge, huge impact on our already fragile health system. So in terms of repair and restoration, so we will count on each and everyone, to make sure that we are able to build back better. I thank you for your attention, and I'm ready for comment, questions, and any other opinion as far as what Africa CDC and African Union is doing is concerned. So once again, thank you, Your Excellencies. It's been a pleasure to be part of this webinar. Thank you. Over.
Honorable Senators, ladies and gentlemen, the two presentations by Africa's CDC has given us a broad sweep of the situation of COVID-19 in Africa. And the second presentation showed the deficiencies and weaknesses of health systems. He also spoke at length and right now we'll have the opportunity to ask him questions. I hope that with your permission, that we give the floor to our partner, Dr. Schumer. He's going to do a presentation. We will have some time to ask questions after. And anyone who wants to take the floor will have the opportunity to speak at that time. And obviously, the colleague. Apparently, we cannot hear Honorable Zingas. You don't hear me? Acting Clerk, Mr. Gali, can you hear me now? So it looks like you have two microphones on and they are echoes. Is that better? Is it better now? Is it better now?
Actually, it's not interpretation. It is the Honorable Zinga's microphone. Apparently he has two microphones open, and this is creating an echo.
Can you hear me now? Can you hear me? Can you hear me? Yes, we can hear you. You can hear me now. Okay, okay. So I was saying that the two presentations that have been made, yes. So can I go on? Can I go on?
Yes, Honorable, you can go on.
Yes, Honorable, you can go ahead. Can I speak? Can I speak, please? Yes, you may. Yes, you can go ahead.
Honorable Zingas, you can go ahead.
I was saying that the two presentations. Yes, go ahead. We hear you. Okay. So now that we have followed the two presentations, we are going to hand over to our colleague from UNAIDS, who is going to do their presentation. And it is only after this presentation that we shall get the opportunity to ask questions to the presenters. That will help us save time. So is it fine with you? We can do it that way.
Excuse me, Chuma. Please select English as your language and mute the original because interpreters can't hear you. They are not able to interpret what you say. You select your language as English and mute the original and click apply. And then do you see more? Or you don't have the 3 dots at the bottom of your Zoom? Yes, I am listening. Continue speaking, I'll let you know, but you see, you're still not on the English channel. I can only hear you when I unmute the original audio. And also kindly put on your camera.
I think that we can help him. We can just let him finish and then summarize. Well, it would be difficult for us to make any summary. And there are other languages also, Arabic, Portuguese, so it won't be easy. Thank you very much. Thank you very much, Dr. Schuber, Regional Director of UNAIDS for Africa, for Eastern Africa and Southern Africa. Distinguished participants, honorable members, the three themes that have been scheduled for this webinar have been presented to us respectively. The two first ones by Dr. Raji Tajuddin from CDC Africa, and the third presentation was made by Dr. Suma from UNAIDS. I'm going now to give you the floor to raise your concerns and ask your questions. And I would like to remind you, dear colleagues, that this is a 2-hour meeting. We've spent 1 hour already, and we have only 1 hour left for the discussion. And I'm sure that all your concerns will be taken on board by our speakers. So may I please ask you to be as brief as possible when you take the floor. The list is open for whom wishes to take the floor. May I give the floor to those who would like to take it? I see Mr. Gali. I think he is asking for the floor. Do you want to say something, Mr. Gali? Can you hear me? Please, can you hear me? Are you following me? Well, I think there's a technical glitch here.
Oui, honorable président.
Yes, the committee clerk is here, Honorable Mary.
Oui, honorable président. S'il vous plaît, il y a une dernière présentation qui sera faite par Dr.
Please,
Moala.
there is a last presentation that is supposed to be made by Dr. Moala. So, after Dr. Suma, we'll be hearing from Dr. Moala. Am I right?
Oui, honorable président.
Yes, Honorable. Okay. I'll give the floor, therefore, to our friend, Dr. Christian Moala, for his presentation. The floor is yours, sir. Dr. Christian, are you here? There's a technical glitch, I think. Can you hear me? Good afternoon. Can you hear me? This is Dr. Mwala speaking. Honorable Chair, can you see the slides of my presentation? I can see your name on the screen, but not, well, yes. Can you see the presentation? The presentation is written in English, but I'll be speaking in French. Okay. Honorable Chair, honorable members of the Parliament, I'm just following up on my colleague, Dr. Suma, who in the first part of his presentation, you just missed the fact that he was saying that they were reinforcing the efforts of UN-AIDS that place the communities in the center, doing advocacy and doing their best to ensure the continuity of the treatment. And this is in the same line of what is said by the presenter from CDC Africa. And then he flagged the issues of human rights and gender issues that existed before, but were highlighted with these pandemics. He also thanked the Parliament for its cooperation. Regarding my presentation now, it is going to deal with the lessons to be drawn from the HIV pandemics and the role of MPs. I'm Christian Mwala, I'm Senior Advisor at the Regional Bureau of UN-AIDS for Eastern and Southern Africa. So I'm trying to use the slides to forward the screen. Can I have some help from the admin? So I have a problem with my slides. So first, I would like to give you some figures first. But I'm not going to insist because our colleague from CDC has dwelt on this issue, but just to say that the impact of this pandemic is, that this pandemic has economic and social impact as well. And as far as UNAIDS is concerned, we're working with countries, with governments and communities on two main aspects that the first one is of the needs of populations, especially the marginal groups, including persons living with HIV/AIDS, but also any other persons in need. The second aspect is the advocacy for the supply of antiretrovirals and all health services. And the other aspect has to do with the continuity of health services, but with the problems of lockdown, the problem is to get in touch with the communities and the population. Problem of health, of right to health, HIV, we need to go to the figures. Let's focus on East Africa and Southern Africa as an example. Over the 35 million people living with HIV, our region has some 26 million. And out of these 26 millions, we have 12 millions of women women, that is more than 50%. It is a generalized epidemics in the region, and we can find the same figures almost everywhere in Africa. And what is interesting but alarming at the same time is that the teenagers, especially girl teenagers and young women from 15 to 24 years, account for 29% of the new infections. That is the people that are more than 15 years old. And in this section of age, we have 4 million new infections per week for young girls, against 1,700 new infections for young boys. Therefore, this is a generalized epidemics, but also we have a higher number of infections for women. This is the first element. The second element is that overall, we had good results in terms of combating HIV/AIDS. If you look at the curve in orange, you can see that the new infections since 1990 to 2018 has considerably decreased, and the number of persons under treatment, the blue color, increased. So there is a success story in terms of treatment, but this success is not guaranteed and is still fragile because of many factors, including the disparities linked to gender. We see that women has less access to some services, health services. When you see, for instance, on these diagrams, the number of new infections, the first one, we have 59% of new infections for women, young girls, against 41% for young boys. Deaths as well, you can see that 50%. But when you look at the third example, that is the status, awareness of HIV status, women are more aware of their status than men, and this can be explained by the program of mother-to-child transmission program, and the women benefit more from tests than boys or men of the same age. When you look at the ART coverage now, you can see that there are more coverage for women, 66%. We talked about the young girls that have a higher prevalence. Now there are some factors that explain, beside the health factors, there are social factors also that explain the situation. We have the community factors, for instance. We remark that issues of poverty and unemployment are higher, the levels are higher for women. And there are interpersonal factors as well. An important factor that is the inequality in relationships, especially male-controlled relationships in couples, but also a strong dependence of women to their partners. There is also some kind of discrimination in terms of laws, in terms of marriage, for instance, divorce, which can be a cause of the violence, gender-based violence. And you can look, for instance, the issue of vote, which is a cross-cutting issue. It is only, we've been discussing in our continent very recently on this that matter. There's a right of women, and the right to vote has become generalized, but it has started only for 60 years ago. There are also individual factors that should be taken into account, because it has to do with the violence in the couple and in the family, with an important impact on mental health. We've also talked about percentage of women and girls. This chart shows these 3 regions of Africa, how the percentage of women and girls are distributed, women and girls that have experienced physical or sexual violence by an intimate partner in the past 2 months. When you look at this, we can see that almost all countries are concerned. There's some countries like the Gambia have a small percentage, but in all countries, almost all countries are concerned with this family violence in this age between 15 to 49 years old. Another chart now is about when we ask girls and young women and young boys, ask them whether they have experienced or seen or witnessed any violence in the family. You can see that all countries are affected and all countries are concerned. And this is not about Africa. This chart is not about Africa only, but many other countries. And you can see that all countries have experienced this kind of situation at least once. So there are, as I said, individual and community and social factors that also explain this violence. So overall, this is in a normal case, HIV situation before COVID-19, but with the COVID-19 pandemics and all the measures taken to stop the expansion of the epidemics, all these problems that existed before will be highlighted by this new pandemic. Therefore, UNAIDS have made a number of proposals to address these problems or these issues. The first one is to evaluate the needs of women or marginalized groups. I said in the beginning that UNAIDS in all countries work with the governments and the communities to assess the needs of the marginalized populations. The first thing that we notice is that the situation of young girls and women is not homogeneous. They face several forms of segregation, of violence and discrimination. And as I said, the COVID is now highlighted and even increased the level of discrimination. If you look at the women with disability, we see that there is a lack of information. Any information that is linked to COVID-19 is not, for instance, available to the blind people, and there is no sign language, for instance, related to COVID-19. Some countries are now doing some efforts in this respect. But when we take all the African countries, there is a gap, a loophole in this respect. When we look at the rural women and girls also are, or the languages used are not the indigenous languages. Therefore, it is very difficult for the communities to understand the information concerning COVID-19. There is also the problem of clean water. There is no clean water sufficient for everyone. Therefore, these are urgent matters that have been revealed by COVID-19. There are also problems with migrant populations, the example of women in prison. We know that the prisons are an environment where access to health is difficult. And with the COVID-19 pandemics, this limited space that is offered by prison is really a problem and can favor the propagation of these pandemics. Therefore, all these problems did exist before the COVID, but they are even worse now with COVID-19. Now, let's go to some good practices regarding UNODC. What they did with the prisoners in Namibia, for instance, they have provided in prisons some specialized structures in order to provide medical equipment to meet women's specific health in prisons. UNAIDS also have in Swaziland, in Eswatini, for instance, UNAIDS is working with all the UN agencies and the government to have targeted messages with leaders of the community, such as religious organizations, but also disseminated messages and information in the labor environment, in the work environment. So we disseminate information on hygiene, preventive measures, etc. And they did so for the youngsters also. Another measure also taken by UNAIDS, it has a private-public partnership with Rekit Bankinsay Group. It's a group that produce soap and disinfectant, but also hydroalcoholic solutions. So with this partnership, we made available more than 220,000 individuals across countries in Africa, from Nigeria to Eswatini to Kenya, for 3 years. Associations and persons living with HIV/AIDS could receive kits, health kits, and this partnership has been made with governments of the different countries. Another thing that is important, just referring to this because it has been well done with CDC Africa, that is the continuity of services during the pandemics. It's true that when we have the pandemics, we focus on the urgency, but we forget that there are other diseases, malaria, HIV/AIDS, tuberculosis, diabetes, and all other diseases. All these persons cannot go to hospitals. Therefore, what can be done is that in some countries, they organized telehealth services for these people to have the all health services. And this is done through video conferencing, and to make sure that all these persons and patients have access to health services. Another good practice is some examples of how some countries have addressed the gender-based violence. In Kenya, for instance, with the civil society organizations and the ministries, they launched a hotline to provide free counseling and make sure that people get all the information and report on any case of violence. So through social networks, telephone, SMS, WhatsApp, they could report any case of violence or gender-based violence. This has been done as well in Tripoli, Libya, for a very short time. This platform received more than 470 phone calls and interventions helped to reduce some of this violence against women. In Tunisia as well, they set up a new temporary shelter for victims of gender-based violence to be taken care of.
So those are a few examples.
These are some examples. The issue also
the issue
abusive
of
use of law and force. We can see
abuse
that
of
in
power,
many countries.
that is
So
an issue indeed.
the key populations,
As a
the key
reminder,
populations are the sex
some
workers, the
people
drug
that are
users,
at risk are sex workers, drug addicts who use needles, etc. But in the case
homosexuals.
of the
So
pandemic, the biggest problem
of sex workers has
seemed
been
the
criminalized in many countries, and with these problems of lockdown, circulation was limited, movement was limited. Therefore, there has been a number of criminalization, legally speaking, and some countries have made available to these women some food and some assistance for them to face this difficult situation, difficult time during the lockdown. Now, in this period, also we saw something that has to do with the disparities in terms of education and welfare and well-being. Throughout the world, there have been more than 89% of students that have stopped going to school because of lockdown, and this can be understood. But at the same time, many of these students had online lessons, but many others could not do so and had problems not only to access education but also to access health and other services, including food, because you know that the school, beyond being a teaching institution, there is food also served in these schools. Therefore, there was a lack of education, but also lack of food and nutrition as well. Regarding the education, health, and well-being of children, the Ministry of Health, for instance, in Lesotho, put in place teleworking or teleconsultation systems with which any young people from 15 to 24 years could come and get psychological assistance and support, and even this was made available to pregnant women as well, young women as well. So this platform has used tools such as WhatsApp and other ITs that are used currently, including for issues regarding reproductive health, preventions and tests for HIV/AIDS, support to mental health, but also the recording of births, because during the lockdown there have been some births, but to register this birth, they could do it through tools. Other examples of the practices as well we have maintain the value of work for women. We know that overall, in terms of labor force, women from 25 to 30 years old represent some 22% of people that live in extreme poverty. Simply either because they have dropped out of school or are unemployed. And here, this issue of poverty is linked to an economic problem. If they have a small, for instance, enterprise with the lockdown, they could not work, and this increases the vulnerability of women. And this should be taken on board also. The other element.
Finally, the other important element, if you consider the role of women in the response to COVID-19. In health workers, there are approximately 70% of women when you count the nurses and assistant nurses, etc. So the fact that they are represented leads us to the fact that we don't really know what measures to take or to adopt in terms of prevention. So that the health department is not completely snowed under. We said that there was a phase before the pandemic with the other illnesses. There was already a disparity between the number of men and women. So what are we doing for the future? Do we stick to the same system? It is the role of parliamentarians now. I'm not going to repeat it, but the Vice President said that we need to establish laws and that we need to play the role of representative and opinion leaders within government and within communities as well. I'm going to stop now by saying that the community should be at the center of the response to HIV/AIDS. The community needs a voice, and without that, we will not be able to attain our objective. The communities must express their own needs. Thank you very much. Those are a few resources that are made available to you on the screen right now. Thank you. Thank you very much, Dr. Mwala. He has made a very specific presentation, very informative. Dear colleagues, we are done with the 4 presentations that were planned for today. The first 2 were made by Dr. Raji of CDC Africa. The third presentation was given by Dr. Shuma, UNAIDS Regional Director for East and Southern Africa. And the last presentation was given by Dr. Mwala. Now, we are left with half an hour to finish today's session. So in the next 30 minutes, we need to ask questions from the 3 presenters who will respond as they do. So the session will be closed by our colleague, the chairperson of the Committee on Gender, Honorable Lucia. So the floor is open, dear colleagues. Colleague Manga, you have some concerns that you wish to raise, don't you? Colleague Paulette from Gabon, do you have a concern? Do you wish to take the floor? Colleague from Chad wishes to take the floor, and in fact, it's Morocco. It's Morocco. Karbal from Morocco. Thank you. Then after that, the mediator, colleague Marie from Rwanda. And then dear colleagues, we are waiting for you to take the floor. Colleague Manga, are you on the list of speakers? Colleague Manga, can you hear me? Very well. There is the colleague from Morocco, colleague Marie, mediator from Rwanda, and Toussaint Manga from Senegal. Maja Seganga after that. Colleague Lucia, did you take down the names of the people who wish to take the floor? Because you're going to be chairing the meeting from now on. Honorable Chairperson Lucia, can you hear me? Yes, I've understood what you said. I said, did you take note of the list of people who wish to take the floor? No, it was to remind you that Dr. Christian did not have an interview. Very well. The colleague from Morocco, please put his name on the list. I need to leave very soon, and after him will be the colleague Marie, mediator from Rwanda, followed by Honorable Toussaint Manga from Senegal, and then Maxa Ngonga, which country is he from? Honorable Chair. I wish to take the floor now since I am traveling. The network is not very good where I am. If I cannot take the floor, please understand that it is because of the network. So the colleague who needs to leave shortly needs to express his concerns or make an input. Hello? Yes, hello? Can you hear me? Can you hear me? Can you hear me? Hello? Hello? Hello, can you hear me?
Portuguese booth. Can you ask the Honorable?
Hello. Yes, can you hear me, Mr. Chairman? Yes, Dr. Tusamanga from Senegal, I can hear you. I won't be long. First of all, I should like to congratulate those who have given presentations. I have a question. What are the initiatives at the level of the African Union? Can we find a foreseeable solution concerning the vaccine? Are there any initiatives within the African Union? The objective is to find solutions concerning the vaccine, because we are in the habit of getting vaccines from the West. And we have become independent from a number of aspects. Thank you. Thank you. I think that our friend, Dr. Raji from CDC Africa has heard your question, and he will respond later. Karbal Nuruddin from Morocco, you have the floor, sir. Could I speak Arabic, please? Of course you can.
Yeah, thank you. Thank you. Thank you for these presentations and thank you for organizing this webinar. I would like to thank all the speakers, the panelists, and commend them for their presentations. You all know very well that COVID-19 will bring about changes throughout the world. Therefore, our African continent should be in line with these changes and should be abreast of it. And now the priorities have become crystal clear. The first priority, the top priority, is to be given to health. Therefore, all the public policies that are to be discussed in the Pan-African Parliament or the African Union or in the national parliaments should give top priority to health. Two, scientific research on health also. Scientific research is extremely important. Besides, we need also to focus on the economic and social impact of COVID-19. The economic and the other thing is to continue using the online techniques to follow up on all what's done in the African continent about COVID-19. Let me mention what has been done by Morocco so far, His Majesty the King of Morocco along with all Moroccans have opened up cooperation with all the sisterly countries of Africa. And and 15 African countries have benefited from assistance and aid So this assistance provided to 15 African countries are all made in Morocco. All of it. All of the assistance. All of the products made in Morocco. Therefore, we need to scale up cooperation and pool our efforts, reinforce scientific research and industry. And I would like to say that Morocco, during these 3 last months, has managed to achieve scientific or to reach scientific achievements. And we need also to build on and take advantage of what has been done, because we cannot manage to overcome these pandemics unless we use the African brain and we use African cooperation. Because Africa has huge potential. Tremendous capacities. Therefore, we need to secure the conducive environment because we are in a transition period. The world is changing. Morocco, as usual, is extending its hands to exchange expertise with all African countries. Morocco I was saying, let's start working, and I thank you very much.
Thank you very much, colleagues. Just a reminder, this is not a meeting of exchange of experiences in our countries. This meeting has a very specific theme. We have had a very high level of presenters, and the questions should go to them if we have any questions for them or if we have concerns. It is not a meeting to exchange experiences between the various countries. Having said this, the floor goes to our colleague Marie Mediatrice from Rwanda. Thank you very much, Mr. Chairperson of the Committee on Health. First of all, I should like to greet all the colleagues, and I would like to thank and congratulate those who have given presentations for the quality of their presentations. I only have one question. Within vulnerable populations, you have spoken about the elderly, poor women and girls during the lockdown period. I would like to ask, how are street children, handicapped persons, homeless people, how are these people protected during this lockdown period? So in other words, what are the various measures that can be taken to protect the people that I have just mentioned? People who are homeless, children sleep in fields, and there are also children who work. So what are the different measures that have been taken to protect this section of the vulnerable population during this lockdown period? Thank you. Yes, Honorable Mediatrice from Rwanda. Can Honorable Vieira take the floor? Honorable Vieira. Honorable Vieira, you may have the floor. Can you hear me, Honorable Vieira? Honorable Vieira from Cape Verde. Can you hear me? Good afternoon, Mr. Chairman. Thank you for the floor. I wish for all of you that you are able to protect yourselves and your family during this period. And I think that hand in hand, we can work for this pandemic. Secondly, I'd like to congratulate the various speakers that have presented good objectives given the context of COVID-19, together with the social impact of this pandemic on our society. We have adhered to the WHO advice on prevention, information, communication, and most of all, for rural communities that do not have access to internet, to radio, to television, so that everyone can receive information and understand the strategic importance of prevention against COVID-19. I think that Africa is taking very good measures, and we need to concentrate also on the technical aspect. We need to develop political cooperation internationally with representatives of the UN, because as far as I'm concerned, if we need to unite
to continue to expand the technical know-how to increase our resilience and our capacity for response so that we can overcome COVID-19. Thank you very much to all.
Thank you very much, colleague Vera from the Cape Verde. Thank you. Colleague Ngonga, are you there? From Zambia, I saw him earlier. Or maybe he's busy. I will hand over the chair to our colleague, the President of Gender, Honorable Lucia, who is going to continue with you. But before withdrawing, I wish to say thank you to our friends, Dr. Tajuddin from Africa CDC, Dr. Schumer from UNAIDS, and Dr. Krisamuela, also from UNAIDS, for your availing yourselves to guide us so that existing partnerships between us should be a win-win partnership. I also thank technicians from the General Secretariat of the Pan-African Parliament, as well as our friends, and the technicians who take care of our commissions, the interpreters. This entire team works under their supervision, under the acting clerk, Mr. Gali Masaru, who I congratulate. So I want to thank you. One voice, one action, and that is what will benefit Africa. Colleague Lucia, you have the chair to continue this meeting. Thank you. Thank you very much.
Before you leave, could you please tell me who you have on your list? Is the colleague no longer with us? I would like to know who else had put their name forward. Colleague Ngonga. I don't know whether he is still online. Do we have no one else who wanted to take the floor, who had put themselves down on the list? If we have no one else, I would like now to give the floor to the speakers, starting with Dr. Raji, to answer the questions and then go in order to Dr. Schumer and then Dr. Christian. Thank you.
All right. Thank you, Your Excellencies, for those questions. So let me start from the first one on what are we doing in terms of finding vaccines. So I'll take this as clinical trials and research in general. So right from the outset of this pandemic, Africa CDC set up a technical working group that is looking at research, science, and standard. Now, this group has been working closely with member states to know who is doing what and where. And one thing this technical group has been able to do is to work closely with WHO. So for the first time, we were able to guide some members. For instance, like WHO Solidarity Trial, we have about 3 of our member states as part and parcel of this. Kenya, Zambia, and South Africa. They are part of this solidarity that is looking at all different interventions, therapeutics, vaccine, and all those things. Then we were also part of the WHO team that sat down to define what should be the research agenda for this COVID-19. And we're all in Geneva to make sure that Africa Voice was heard on what exactly should we focus on, not just for academic exercise, but something that will add value, a research that will add value that will make us to control this pandemic. Now, going to the specific question on vaccine, currently we have two countries that is looking at the use of BCG or repurposing BCG to see what it can do as far as the prevention of COVID-19 is concerned. So this is part of one of those candidate vaccines that we are all looking at to see which one is going to get there first and rally the entire world around it and begin to use it. And still on the issue of a vaccine, we know that, the vaccine can come from anywhere. So in order for us to have access and to be able to afford whatever the cost, so we'll be working closely with the leadership on the continent, right from head of state level. And this is one of the things that inform the meeting that is coming up next week, that will be looking at affordable and equitable access to vaccine should it come up. Our pool procurement platform is also one other thing that will allow us to buy this thing in bulk if at all it come up from maybe somewhere else and we need to buy it. So we have really positioned ourselves and make sure that when this vaccine does come on board, we will make sure that our continent will have access, in an affordable and in an equitable manner. So that's that for the vaccine. I will take the Morocco question as comment. So it's a welcome development what Morocco is doing, assisting our member state. So this is part of the South-South collaboration that we are talking about. And it's also interesting to know that virtually all the things that were distributed by Morocco, which are mainly personal protective equipment to the 15 member states, were manufactured in Morocco. Again, this is one of the things Africa CDC is pushing for, to ensure that we build local capacity, we ensure technology transfer. You can imagine if most of these things are produced on our continent, the so-called global shortage, won't be an issue. So we are using this opportunity to make sure that we build local capacity. For instance, when we talk to companies that want to manufacture ventilators for us, we tell them, please, can you partner with some of the companies in Africa? So we have some companies in Ghana now that is working with US colleagues, and in terms of producing mechanical ventilators. We have a company in South Africa, a local company that is looking at production of ventilators. We have Dakar in Senegal and even Morocco looking at local production of test kits. So these are the things that Africa City has been doing, working with them, matching partners to them to ensure that, one, we build local capacity, two, we ensure technology transfer as far as this is concerned. So in terms of the vulnerable population, we did a lot in that regard. So for instance, we know that at the African Union, we have the Department of Social Affairs that is looking at this. So we are working with various partners in this regard. For instance, we know that places of detention is one of those areas where we have a lot of vulnerable groups. So we are working closely with international community of the Red Cross. One, in terms of policy, two, in terms of how do we ensure that the COVID-19 response in those places is contextualized to that. For instance, we had a series of webinars together with the different prison services from our member states on what they should be doing going forward to make sure that as much as possible, we mitigate the effect of this COVID-19 in such places. We also have IOM on board as part of our task force. We're also working closely with them to ensure that migrants are not necessarily exposed to this COVID-19 by virtue of their vulnerability. So we're doing a lot with all these different groups. We also have UNAIDS as part of our task force to make sure that those people who are affected by HIV/AIDS are also not left behind. So let me stop here and allow my other panelists to also respond to some of these questions. Over, thank you.
the CDC, and all the heads of states are members of this group, especially our executive secretary. The colleague has also shown in the presentation the slide of the advertising. That is for the contribution of the African Union. But I also want to come back to the question of honorable member from Burundi, which is an important question on street children, people living with disabilities. Excuse me, the honorable member from Rwanda. Excuse me, ma'am. So I think it's an important question. If you heard in my expose, I was saying that the question of communities is something that the UN needs to be focused on, and we should leave no one behind, and that includes people who are marginalized, um, people who live in the streets. And when we have epidemics, especially, for example, the case of AIDS, they are the most affected. Even in the case of the COVID, I'm also talking about petty traders, those who live from day to day with quarantine. They cannot go out to sell. They cannot sell in the streets. Even also the children who live in the streets, it's difficult for them to survive. There is no miracle recipe. So we need to assess, do a needs assessment, and then we do mobilization at the level, local level, as well as all the technical experts in collaboration with the government and the community, because they best know where need is. And that is why I was talking about adolescents. So they are women in all their diversity, all these minorities, all these communities, so that they are not left behind. I talked earlier about young girls living with